Hey guys, Kim Dunbar here, and I was scrolling through YouTube and realized that there is a trend going around asking CVTs all about their business as being vet tech. So I was like, you know what? I'm in a vet tech for a little while. Let me get on this trend too. So I wrote down a couple of the Q&A questions just to make my life easier, and we're going to go through each of these together. Sounds good? Okay, so how long have I been in the field? I have been a certified veterinary technician since 2008. I started out in general practice, then I went over to emergency and critical care, and then I just kind of did the back and forth for a little while, but ultimately I ended up just kind of staying in emergency and critical care for the remainder of my career. So let's see, what got me involved in the field? I've always loved animals, like always. My parents and sisters, they will tell you, like I was obsessed. I actually went to a high school where they had a working farm. So, and they actually confirmed that we would get certified veterinary assistant credit when we graduated high school. So I thought that was really cool. Um, and then when I decided to go to college, I was going to go for veterinarian, but life happened, so I ended up being a CPT instead. Let's see, where is the drama at work? um, the drama could be wherever you want it to be. Personally, like for me, I honestly, I know that there is a lot of drama at different hospitals, specifically, when you have so many strong, passionate people in this field. But honestly, I try to stay away from a lot of it. In my career, I will say I've been picked on or called out for being the only female tech, for being the only black technician, for being a Christian technician. It's, I mean, but I feel like everybody in every work place gets that same drama. So, but for me, I'm like, that's you. That has nothing to do with me. I love who I am and what I am building in my career, so I keep it moving. So I hope that you guys do the same thing. Let's see. Is vet tech school hard? Yes, it's freaking hard. I studied my soul off. Okay, I digress. I had wonderful teachers who were in the game, like in the vet tech field for at least 10 years. So they taught us, what we needed to learn for the national exam and what we needed to learn to be effective technicians in the field. It was great. And I mean, I studied a lot. I had a schedule for what I studied, how long I studied, and when I practice tested myself. Be that as it may, and I'm sorry, and with that, I was able to actually pass my boards the first time. Hallelujah. So I will say, yes, it can be hard, but if you're willing to put in the time and energy to study and learn and ask questions, don't be afraid to ask questions. You will get there. You'll pass your VTNE and you will become a certified vet tech. Let's see. Did I always want to be a vet tech? No, I wanted to be a vet. Like, always wanted to be a vet. And when I graduated high school, I actually was going to go to the University of Minnesota, but life happened and I ended up not going. I went to a community college for a couple years instead until the vet tech college close to my area, they opened up and they kept their accreditation for a while. I think I was one of the first handful of vet tech students that they passed, so I was really, really happy for that experience. Let's see, euthanasia and death. How do I feel about it? I mean, how does anybody feel about death? Death sucks. I guess for me though, a lot of questions I get. The main question I get is, does it ever get easier? Euthanasia never gets easier. I guess for me, I can say that euthanasia becomes more of a gift that owners can give their pets. It's a gift to end their suffering. It's a gift to allow their babies to not feel any more pain, any more suffering, especially when they come in emergency and critical care, where a lot of times there's no options for them to recover from whatever it is that they're dealing with. For me, it's a blessing to be able to help the owners and help the pet to get through this heart-wrenching moment with as much dignity and as much care as we can. That's all I got about that. Next question. Would I prefer to become a vet? No, no. Not as of now, no. I do not feel inclined to become a veterinarian. I love being the hands of the doctors. They are the brains, we are the hands. And that's my little goal for myself. Will I consider a specialty though? Yes, and actually I'm working towards one, but I can save that for another video. Um, Will you be poor as a vet tech? The first couple years, heck yeah, you'll be poor as a vet tech. Like, ooh, when I first became a vet tech, I was making 12.50 an hour. I could have made more working at McDonald's, but I kept in there and I stayed in the field. I learned more. I became more useful. And that's the thing, like as a baby vet tech, just take the first job you can freaking get and just stay there. Stay there, learn as much as you can. Give yourself 2 years. If you can stay in this field for 2 years, then you will have options because then you will have learned a certain foundation. You'll be able to decide where you want to grow from that foundation. For me, it was emergency and critical care. For others, it's dentistry, dermatology, radiography. Like there's so many different avenues that you as a vet tech can go in, and the more experience you get in all of them, the more useful you'll be, the more money you can command. Make sense? Okay. Let's see. Well, I guess I should answer that question a little bit further. Am I poor now? No, I'm not poor now. I'm a vet tech in Florida, and again, because I'm a crusty old nurse, I can pick and choose where I want to work and what I want to and who I want to learn from. So again, that kind of comes with consistency, always being willing to learn, always willing, never stopping. Like I never stopped being a vet tech in any measure of time longer than to, go on maternity leave with my babies. I always came back, so that helps. Let's see. How do you draw blood from a jug? Okay, so basic anatomy. Your jugular vein is the vein that is alongside your neck. So what I like to do, or what the standard is, you take your thumb, and depending on which side, you just find the clavicle, and you press on the indentation of that clavicle. And what that does is it helps to protrude the jugular vein, so it helps it to pop out a bit. So as it pops out, you are able to actually feel for it. And as you feel for it, you're going to feel exactly how it's traveling. So then you take your syringe and you're going to have your needle, and it has a little arch in it. So you look for the bevel up. And then you poke through the skin, poke through the jug, draw back, never push your syringe forward. And then you just hold off. The more hyper the dog, the longer you hold off because that blood circulates fast. Okay, next question. My favorite scrubs, Healing Hands scrubs. They are amazing. I am not affiliated, but they're soft and comfy. I am a pear-shaped vet tech, and I do not flash people when I wear these scrubs. Get these scrubs, my future pairs. Let's see. Best way to improve my skills. Ask questions. And do not be ashamed to ask any question. The only dumb question in this field is one that's not answered. Even if you get eyes rolled at you, ask the dang question, so then you'll be able to be better at it. And follow your specialty. If you are a GP nurse and you decide, you know what, you really want to get into surgery, find a surgical specialty or surgical specialist in your area and ask to shadow them. There's no shame in asking to shadow. That's just somebody watching for free in the field. And if you decide you fall in love with it, see if you can pick up part-time. See if you can slowly transition to full-time while you try to make some decisions. It's amazing. Like, don't be ashamed to pursue what it is that you want. Read books. Take all the CEs, whether they're recorded or you go to symposium. Never stop learning your craft. Let's see, dogs or cats? I've had cats for years. I love them in my house. Now, would I have a dog? I guess if I wasn't a vet tech. I work too much. Like, I work so much. For me, I'm like, I want to be home. Like, if I can't be home, I feel bad as a vet tech not having, my animal have some freedom. But I know other people that bring their animals with them, and kudos. But for me, I'm like, I couldn't have a dog or I choose not to have a dog. I choose to have a cat that I can leave at home, you know, for a couple hours. It's like a teenager. As long as it has food, water, and some cable, it's fine. Let's see, restraining while pregnant. So again, I have two children, a boy and a girl, and each round of my pregnancy, I have to say I loved my teammates. I did not restrain anything that was over 20 pounds when I was pregnant. If I tried to, my team reprimanded me viciously for it because they reminded me, if you give birth here, we cannot help you. So, restraining my pregnant, I mean, I did what I could from my shoulders down. And if it fit in that area, then I could do it. If I had to get on the floor to restrain, nope, that was off the premises for me. As working where I worked and with the team members that I worked with. Now, I know that there are some places where, I mean, hey, your staff is short and hey, maybe they don't care, but your health is your priority. Never, ever put that in jeopardy. Ever. Let's see. I think last question. Oh, that was pretty fast. So, advice for future vet tech. So, if you want to get into this field, please know that you are getting into this field to be an animal nurse. You are here in this capacity to help your patients. Helping patients that specifically can't tell you it hurts right here, or I'm thirsty, or can you please help me roll over. You have to learn, and this part is a lot of just learning from exposure and experience. Yes, when you go to school, you're going to be learning about all the textbooks, and yes, soak it all in. But when you get out into the field, a lot of it is just going to be your experience with these patients. Take the time to get to know your patients, to understand their body language, what it looks like to be fearful, what it looks like to be aggressive, what it looks like to be aggressively fearful, you know, and how to best help your patient to get better and get the heck out of your hospital. I'm like, you're here, all right, how much longer do we need to get you out of here? 2-3 days tops. That's what I'm hoping. That's my route. And don't be afraid to remind these doctors what you're worth. I mean, a lot of people leave this field because they get lowballed when it comes to pricing. Yeah, your first job, get the fudge what you can. But after you get some experience, say, hey, I've gotten experience and I've been with you and I plan on being with you. And here's what it is that I'm taking advantage of as far as my education. This is the specialty that I'm looking forward to getting into. Or if you're not looking for a VTS, this is what I'm trying to focus on so I can bring more into this practice. I believe that in order to get this, I need you to either pay for this continuing education and or pay for my raise after I've received the certification, go to this continuing education, because this is what I'll be bringing to your practice. And yes, that can be a little scary sometimes, but if you will advocate for your patients every day, why shouldn't you advocate for yourself in your future? Keep that in mind, okay? And keep reading. Like, I mean, I'm still taking CEs right now, and I'm still learning, and it's still excited to learn how quickly and how vastly the veterinary field is opening up, and you know, the respectability that we nurses are getting finally. So I think that's it. I hope you have enjoyed this Q&A. If there's any other questions that I can answer for you, please drop them down in the comments. I can probably do a part 2 based on the questions that you guys asked me. And yeah, for those who are studying now, happy studying. Pass those boards, baby. Leader.